I think we're going to go ahead and get started. It looks like we have a number of folks logged in on the webinar. So I want to be respectful of everyone's time, and we have an hour scheduled today. So thanks again for joining us. This is the technical assistance call for the Smoke Free for Me Learning Collaborative that we mentioned at the learning session. Just want to mention we have several of our programs on the line, including Dr. Gittleman, Samantha, who is our quality improvement consultant. You did not get to meet her at the collaborative, but she is with us today. We also have myself and Kristen Fluitt, and we have several of our partners from the GRC, including Kristen Howard and Marika Paul, and I believe Allison Lawrence also on the line. And just to mention again, like we did at the learning session, we have a lot of support in working with the project, and like I said, we have some folks from the GRC on the line today as well who will help talk to us about some of the data submission questions that may have come up over the last week or so. Just briefly to go over our agenda today, we're just going to do a quick roll call to make sure I get everyone that's on the line. We're going to just review what it's been like to get started on the project over the last week and a half, talk about a few reminders for the data sheet and the program handouts, go over a few data submission reminders, a quick review of MOC4 requirements, and then talk through some implementation challenges or questions that you have. So just to do a quick roll call, I just wanted to check in. Who do we have on the line, if we have anyone from Locust Pediatric Care Group? Okay. Anyone from Cornerstone Pediatrics? Anyone, I believe we have on the line from Children's Medical Center Middletown, Dr. Gallagher and Dr. Small. Is that correct?
Yes.
Great. It looks like Dr. Hornick, are you with us from Cleveland Clinic?
Yes, I am.
Great. Do we have anyone from Cleveland Clinic, Maine? Cleveland Clinic, Medina?
Yes, I'm here.
And who's that? I'm sorry.
Oh, this is Christine, team lead for Cleveland Clinic, Medina.
Oh, great. Thanks for joining us. And Cleveland Clinic, Twinsburg? Cleveland Clinic, Stephanie Tubbs-Jones? COPC, Pediatric and Adolescent Practitioners?
We're both here.
Virginia DeVerte and Tony Hall.
Great. Thank you both for joining us. Eastgate Pediatrics, I believe we have Kamisha Carroll on the line. Is that correct?
Yes, ma'am.
Great. Thank you. Fairfield Primary Care Clinic?
I'm on here, Jennifer Hardy.
Oh, hi, Dr. Hardy. Thanks for joining us. Do we have anyone from Group Health Anderson on the line? Okay, anyone from Ohio Pediatrics?
I'm here. I'm Tammy with Ohio Pediatrics. The doctor's still seeing a patient at this time.
Oh, okay, well, great. Thank you for joining us, Tammy. Anyone from the Christ Hospital Physicians?
We're here.
Great, thank you. I see Dr. Lazaron, your name on the webinar. And then University Hospitals, and I think I may be saying this incorrectly. Is it Medina or Medina? Is anyone with us from University Hospitals? Okay. And then I know, Dr. Hammond, you're on the line from Wheeling Pediatrics.
Yes, I am.
All right. Well, again, thank you all so much for joining us. And today is really the opportunity for us to chat through any kind of questions, implementation issues that have come up. I really want to thank those of you who have sent me questions via email Those have been really helpful because if you've had them, other folks have had them too. So hopefully we're getting those answered, and we can talk a bit about that today. But just as a reminder, when we ended the learning session, we talked about kind of what the steps were to really get started. And so today is just kind of a chance to reflect and say, how did that go? The big thing was, of course, to start administering the screening tool and completing the 5As when appropriate at every well visit for infants age 0 to 1. So we want to hear from you. How did that go? Were there things that came up that made it difficult? Were you able to work through those, or are there still things sticking around that's been impacting that? Does anyone have any comments on that?
I just have a question. We started on Thursday, and truthfully, I've only had 2 patients, and thank God none of them smoke in this age brain. But on filling out the back sheet, especially if they don't have anything, are we still supposed to comment on doing the 5A steps during that visit, yes or no, and then signing our name up with the provider initials?
Yes, you should go ahead and do that. The database system will know that, you didn't do the 5As and you weren't supposed to do the 5As. But we do still want you to complete that last sheet.
Oh, even if they're not smokers?
Right.
So we just say no to completing the 5As?
Right.
Okay.
And Kristen, this is Kristen from GRC. Just as a reminder, if in the case where the person filling out the form doesn't smoke and is breastfeeding and is practicing safe sleep, we still need all pages of the document, even if they're not filled out. We've had some sites that are sending just the pages that have been completed, and that will scan in as an error because our system looks for all 4 pages of that document, not just the ones that are filled out. So even if you're not filling out those pages, please make sure you're still scanning or faxing them.
And so for that type of patient, you should answer no to the 5As and sign your initials at the top.
Yes, if they're a non-smoker. And you may have non-smokers that there's no smoking, but you did come across, problems with safe sleep practices.
Right.
So you would still indicate on the form that you've counseled about safe sleep, provided the resources, but you did not complete the 5As because you didn't need to. And so the system will be able to understand, no, you didn't do the 5As and you weren't supposed to.
And I also have a question. This is Mary Hammond. When some of my patients have, even if everything was no, they don't smoke, no one smokes, they missed a little big red stop at the bottom of the first page, and they've gone on and answered some things on the next couple of pages. Will that get kicked out as a wrong thing, or will they? What's going to happen with that?
No, that should be fine.
Okay.
And here's another question that we have is if we find somebody that's more willing to quit smoking, we fill out the referral, I guess the questions we still have, a lot of our patients don't really qualify for that quit line, meaning they're not on TRICARE, Medicaid, and they have private insurance. Our group is a big group, and it offers a smoking cessation for free for actually anyone. It doesn't even have to be our patients. So I think how we're trying to do this to make it qualify for your system, even though is that I guess we'll call and refer. But, I mean, what are you guys saying to the people that have, like, say, Aetna insurance? I mean, we look and we can see they have insurance. Really, how are we supposed to functionally manage that with this MOC4?
So this is Mike Gittleman. As we talked about at the Learning Collaborative, I mean, the goal is still to refer to Quitline. Quitline will follow up with everybody. If you have other interventions that you're doing as well, you can also put those into place, but all we're tracking is those referred to Quitline and how they do at follow-up.
And, well, some of them, I mean, for my practice, a lot of them won't even qualify to get your services. So
we were told from Quitline that anybody that's referred, they will follow up with.
Okay. Just because it's part of this process?
I'm not exactly sure whether it's just part of this process or it's just their goal of trying to follow up with everyone they get referred to. Now, if they personally can't help them because of insurance, then they will find another way to help them out.
Okay.
Okay.
I guess we'll send them and then we'll give them the information from our system also.
Okay, were there any other comments just about the administering the screening tools or any questions? If not, I just wanted to quickly review the submission portals for the data and the workflows or PDSAs that you'll be doing, because I think there was some confusion among many practices. So the portal for when you are submitting your screening tools is the OSU portal. The other portal, the KEDA portal, is for workflows and upcoming PDSAs. So does anyone have any, have you had any challenges with those, with the portal or faxing or submitting your data?
We've been faxing our data because the office manager found the portal kind of challenging. So, and I was a little unclear if we were going to be faxing the PDSA and the workflow, where to fax those to.
I can follow up with, is this Dr. Hardy, by the way?
Yes.
Okay, Dr. Hardy, I can follow up with you on if you need to fax workflows or PDSAs, where to fax those to. So I will give you a follow-up email about that. But, yes, for any of the data, you would either use that OSU portal or the fax number that's on the cover sheet to submit the screening tools.
Could you send the fax number for the workflow and PDSA to everybody, please?
Yes, absolutely. Okay. Just a couple of quick reminders about the data sheet or screening tool and handouts. The link that I believe you all have in an email, I will also include that in the follow-up email that I send from our call today. At the link, you will be able to access all of the handouts and print those from there. We've had a few sites who needed us to print those and mail them because they didn't have easy access to color printing, and we can certainly do that for other sites. So if you need that, please let me know. But you will be able to print the resource handouts from there. You'll also be able to access the link to the recorded learning session if you need to review anything, or the slides. And we'll continue to upload slides from our action period calls. Just a couple of quick reminders about the data sheet, and then anyone else from the team, please chime in, and we can also talk about any questions. Just be sure that circles are being completely filled in on both when the families complete that and then also when the providers complete that. You cannot use slashes because it will read as an error or incomplete data. We have had some folks who have had errors using a pen, and so I wanted to also get our GRC partners to talk a little bit about that. If there are errors with a pen, what the best response would be to that if you catch those. We had originally thought of just using pencils, but sometimes pencil marks aren't dark enough for the technology to pick that up. So just if we have errors once in a while, it's not going to be a big deal, but we want to make sure that we don't have a lot of those. Also, it's already come up, what if no one is smoking? So in that case, the family would stop the tool after that first page, theoretically, but we do need the provider to still fill out the provider data sheet and send in all pages of the form. Another quick reminder, all of the tools are all pre-printed and numbered, so do not photocopy any of the data sheets because those each have a unique number on them, and we will be sending you additional ones monthly. So make sure that if you are starting to run out and you haven't gotten your supply, just send me an email, but we will try to make sure you always have those pre-printed and should not be photocopying those. I mentioned correcting errors. Also, I just wanted to let folks know we did catch, thanks to one of the practices, an error on the provider data sheet that we will be correcting. And just to let you know, that is in the red box below. If no other is smoking in the home, there is no need to give a handout. So we will just be removing that reference to handout number 3. That doesn't really affect anything, but I think it was just confusing for some folks, so I just wanted to let you know about that. And then there was the question about if the person bringing the infant in is someone other than the primary caregiver, how to handle that. And it is as if that person is completing the form based on their smoking behavior. So whoever is bringing the child into the appointment is answering the tool. If, say, grandma is bringing the child in, she's answering the tool for herself. She would be indicating if mom is in the home smoking too, then mom would be a smoking other in the home based on that tool, and a provider would try to counsel around that. So you work with whomever has come into the appointment. So folks from our team, are there other reminders, things that we want to mention around?
I have a quick question. The handouts, we were just photocopying them, and we do not have color printers. Is it okay if they're black and white, or do you want us to have color handouts?
So I
we
think
don't have access. We don't have access to color.
It's okay. I mean, if they're black and white, okay. I think from our perspective. But if those are something you would like in color, we can certainly send those to you.
Okay.
Any other comments, questions, reminders about the data sheet or handouts?
Hi, Kristen. This is Kristen. I do have a few that have come up in the last couple of days. Like I mentioned, please make sure to send all pages of the form, even if they're not filled out. If you're faxing or scanning, try to scan them in the correct order, just because we have to go in internally and move them around if they come in out of order. If you're faxing or scanning in multiple submissions, so if you're going to send 3 different fax submissions, please try not to separate the packets between them. We've had a few instances where pages 1 and 2 of a form will come in on one fax and 3 and 4 will come in with another. As long as you are using the numbered forms, that's fine, but if you're photocopying, it's really difficult to match those up. So try to keep each packet together when you're submitting faxes or scans. Please use our provided cover page because we use that for data collection as well. And we did talk internally, pencils will be fine. There was a question about using Sharpies just to fill in the dot, but that will bleed through and that will cause problems with the data submission since the form is double-sided. So avoid Sharpies, please. And if you're filling out the form for more than one child, which we've seen happen a couple of times, make sure you're entering the date of birth for the child between the ages of 0 and 1 in the section provided, because that's the data that we're really looking for. We've had a couple where that information has been filled in for children that are older than the age range that we're looking for. And so we'll still be able to collect it, but it does, again, throw errors in terms of our data submission. So if you're going to do that, that's fine, but fill in the birth information for the younger child rather than the older one. And I think that's all.
Okay, great.
This is the Christ. I had a question about the numbering on this. When we looked at our data sheets, we realized that a couple of our questionnaires have gone missing, whether they got handed to a patient and the patient took them home, or they didn't get collected to a central spot, and so we've lost track of where they are. How crucial is it that you get all the numbers? And does that really factor in? We've just kind of proceeded on and continued on with the next numbers, saying, okay, I lost number 5. I have no idea what happened to number 12. Does this actually really even matter in your case, or are you just putting the numbers on to make sure all the pages are collected for that data submission?
I'm trying to make sure I'm understanding your question. So let's say on tool 1, you're saying that you lost one of the sheets from tool 1?
No, I'm actually saying I lost the whole questionnaire. We know we can't, but then we don't. I have no clue where that questionnaire either didn't get graded or it didn't get back to us. So, like, we have a whole questionnaire or a couple of those just lost in the ozone.
From DRC's perspective, that won't be a problem.
Yeah, no. If you're saying you lost, like, questionnaire number 2, that doesn't matter. The numbering at the top is really to help us know all of these pages are on this patient with the birth date of 12/9/73, or something like that. But if you've lost, say, tool 2, we're not looking to say, oh, that tool's missing, or if that makes sense. I hope that's answering your question.
Okay, great, thanks.
Okay, a couple of data submission reminders. Again, the fax and the upload cover sheet, if you need that, is at the link that's referenced. We've already mentioned, make sure you are sending and faxing the front and back of both sheets of every tool, and only submit data for infants 0 to 1. If you are using the tools and using these for other age children, that's fine. But the only data that you need to send to us is data for infants 0 to 1.
Has left.
So did anyone have any additional comments or questions about data submission?
Oh, I have a question, but not about data submission. Should I wait?
No, go right ahead.
You guys sent out a nice thing on the nicotine replacement therapy, but it doesn't include the contraindications for nicotine replacement therapy, and that was what I was kind of hoping to get, because we have to sign the thing saying whether or not the parent can receive it, so I don't have any idea who can't receive it.
Okay, I can follow up with our smoking folks and get you the contraindications for that.
Thank you.
You're welcome. Thanks for bringing that up. Okay. I just wanted to mention, and again, I will include this in the follow-up email. We referenced this also. It was in the QI packet that you got at the learning session, but just the MOC 4 requirements. And you can review those, but I just wanted to make sure I mentioned those. And Sam, is there anything from these that you wanted to highlight?
I think the main thing and what we've kind of been reiterating as we've been talking about everything is just getting our work and process flow into place so that we are capturing all of our well visits birth through 1 year of age, and then also having a system in place for number 6, which is making sure that we are getting these or documenting the number of well visits that have been attended, so we have a nice denominator for knowing how many of our families actually got the screening tools in that birth through 1. And then as we move forward into the Learning Collaborative, if you've participated in any Quality Improvement Collaborative with a chapter before, the attendance on the monthly action period calls I think are really instrumental for keeping you engaged, hearing how things are going with the peers that are also participating in this, and sharing challenges and successes. So making sure that you have the time carved out on your calendars. I know it's a little hard to do it up front, but knowing the dates moving forward, to have that carved out on your monthly calendar so that you can attend those, get the topic information, a review of the data, and then hear how everyone else is progressing with the work.
Great, thank you. So we wanted to make sure we had time, and I know we've already talked about a few challenges and questions that have come up, but this is your opportunity to review any of those with us, ask questions, get clarifications, get things you need to support you in doing the work. So we wanted to make sure we had some time to hear from you.
I have a question. I was thinking. Hi, this is the Christ Hospital System. I'm Elizabeth Lazaron. We had a challenge that we came across, and I was hoping that somebody else had either experienced this or worked through the problem and been able to give us some advice. And it's specifically about when we've handed out a questionnaire and then we sort of lose it. So have people worked with either identifying a specific person in your office who then collects and makes sure they're back and graded, or a specific site? You put the questionnaire when it's done. At the back end, when we've got all the things, we just want to make sure that we still have the paper on hand to be able to scan to you. So any insight people have had as to what worked well for them, I'm all ears.
This is Julie Fenig, Ohio Peds. We are collecting every person, every physician who's part of this collaborative. We're putting at the front office where we'd normally turn in our charts, there's just a box, simple cardboard box sitting there, and we are putting the surveys in that, and then they're being faxed by our front office staff.
So yours is a location instead of a person you hand it to, and that works out well?
Correct. And then we have a front office staff person collecting them at the end of the day and getting them ready to be faxed.
Are you having any trouble, Dr. Lazaron, with them making it from the family member's hands back to the provider, or is it after it's in the provider's hands getting to the right spot?
Yes to both. Sometimes we're getting families, but because this is the season of the year where they're filling out new registration, they're also filling out their ages and stages form, and then they're filling out our survey. Often they're wandering back to the room still with a clipboard and trying to fill things out. And so I think we're not collecting 100% of them before the visit because there's too much paperwork right now. And so I think a couple of those have gone astray too, where they then didn't get addressed.
Sam, I'm just wondering with other projects that you've done, if you've seen any strategies or things that have been helpful, because I know there can be a lot of paperwork mingling around and just making sure things get to where they need to be.
Exactly. I was thinking of our injury prevention collaborative where there's a similar process of quote-unquote grading the family's responses. And there was always kind of a point person within the context of their office flow that once the family completed it, whether it was in the front office and the front office handed it, or when the nurse took them back to the exam room or was doing the height and weight, that that person was responsible for reviewing the family's responses to know whether or not there needed to be a discussion on injury prevention, anticipatory guidance. So very similar here, having that point person that it's their responsibility to get the tool and make sure that one, they have to question or have any positive responses on smoking, and then looking at the breastfeeding and the safe sleep and seeing if that information needs to be discussed. And if they're the ones discussing, or if they kind of pass it on to the physician that's going to be discussing it, to kind of help with the continuity, or having someone to be the person that has that in hand, so you know at least it's gone from the family to a provider within the clinic. and then you can move on to the next step of the office flow of getting it to the person who's actually discussing and giving resources. Do you guys have kind of Christ Family Hospital, do you have the person in the middle, or does it directly go to the physician, the person that's in the office counseling the family for that well visit? Dr. Lazar, are you still on?
Yeah, I think the biggest challenge has been we've got a process worked out for when a family's like effectively finished the questionnaire before the MA is rooming them or in the rooming process. It's sort of like after the MA has completed the rooming process and there's still 5 pages of work they're working through. It's trying to the who doubles back when and before that part is done is what we're still struggling with a scenario for. And often the provider is going right in, and if they still haven't gotten through the paperwork, then I think that's been our challenge of how do we incorporate this within the workflow.
That might be a good opportunity for one of your PDSA cycles. You can try several things where either there's just thinking randomly, a sticky note on the door that this needs to be collected, or if they're going to leave the office, if it's normal for the families to book the next appointment, especially within this first year of life, does come up easier or within the schedule of booking, that the front desk is in the habit of asking, do you have any other forms that need to be provided back to us, and kind of have that on their radar, trialing one of those types of situations for your first PDSA or second PDSA on how you can get those tools back.
The sticky note on the door is brilliant. We may just plug that in for our next PDSA. Thank you.
Oh, good. I thought that was stupid, so I'm glad that works. I was just trying to think of something. Good. Okay, so I think like some of those red flags, either in your EMR or something on the door that can go there.
Okay, thank you for that. I think that was probably could be helpful to a lot of folks. Other implementation challenges or questions that folks have that we haven't touched on so far?
If you want to go to the next slide, Kristen, it might help jog just different points that I kind of pinpointed with the process flow and potential PDSAs. Be it getting the tool to the families, how you're reviewing responses of the families, if you're talking and to the point where you're comfortable with those two, how you're approaching the counseling for any positive screens from smoking, safe sleep, and breastfeeding, any resources that you need to give. And I think we've discussed pretty well data submission, but then the final piece of checks in place for data integrity and making sure that the tool's completed, circles are properly filled out, not splash marks, that type of thing. So anything on this list that you found that's worked really well as you've gone through this within the first week or so, or something that you have a question on, just like Christ Hospital had.
This is Fenig from Ohio Peds again. I did have a question with our providers here. If our answer to the safe sleep question is no, that they're not having unsafe sleep practices, but the provider just in their regular anticipatory guidance does discuss location and position and all the sleep, points, does it need to be marked, yes, we discussed it, even though the initial risk factor was low? Do you want us to go ahead and mark what we discussed anyway?
And Kristen Howard, you can correct me if this would impact any of the calculations, but I think as long as we don't have an indication that family needs to be counseled on, it's not going to ding or inflate something. But if it's part of your care and you are counseling, I don't think it's going to hurt to say that you have counseled the family on the ABCs of safe sleep. Does that sound correct, Kristen?
Yes, that sounds correct.
Okay.
Okay, thank you.
And as you guys have been going through office flows, we've seen a couple of those come in already. Heather, before she left, has provided feedback and comments on those. If you do upload them to that KEDA link that Kristen mentioned at the beginning and we'll send out again, there is an option to say, I would like feedback on this, and I'm happy to, and it's that hyperlink that's at the bottom, the KEDA Submit. If you have any questions about your office flow or your first PDSA, you would like to talk about it a little further, feel free to reach out to myself or Kristen, and then you can also submit it to that KEDA and select, yes, I'd like feedback on this. And I'll walk through and give some feedback on how things look, any questions, next steps to help with finalizing that office flow and test or change that you can do around that, and then for your initial PDSA.
Is there any assistance that GRC can provide for data uploads to the REDCap site? I know someone had mentioned there was some confusion about that. Is there anything we can do to clarify or any questions we can answer about that?
Are you mentioning, I think Dr. Harding, you had mentioned that it was a challenge using the SFF Ohio AAP site at OSU to upload. Could you walk us through what was difficult about that so maybe we can alleviate that for other providers?
I'm not seeing Dr. Hardy's name on the webinar, so she may have dropped off the call. But one thing I will do in the follow-up email is include the guide to data uploading, and so folks can take a look at that again. But if you are having challenges with that, please do reach out and let us know, and we will make sure that we get someone to support or help you with that. And if we don't have any other questions or comments or things that we need to kind of work through, we just had a couple of reminders. Sam, I don't know if you wanted to talk about a little bit about the process flow, again, that's due later in the week.
Yeah, so as mentioned at the learning session, your process flow, the first kind of iteration of it or something that you have tested or worked and incorporated from the Smoke Free for Me collaborative into your current office flow, that's due this Friday. It's submitted to that KEDA Submit URL, or you can scan it and email it to Kristen or my email address or fax it with the number that Kristen will be providing. Any of those methods are appropriate for sending that to us. And then again, if you have any questions about how to compile that document, how to work through challenges as you approach the end of the week and this is due, feel free to reach out, and we're happy to, have a call or email back and forth on any of those items to help you make sure that you're getting this to all your patients birth through 1 year of age.
And then our next action period call will be on Tuesday, February 27th. I will be sending out invites for that. And that's when we will also, again, review PDSAs.
We'll come up with a couple concepts to be tested around that, and then shortly after that or around that time, your PDSA will be due as well.
Do you want the PDSA sent before the action call?
If you're comfortable with doing PDSAs, you certainly can, and you can check that off. We've given you, I'm trying to think where those were dates, or we have set dates that we'll be providing you in the future of when those will be due. So you can follow that, or you can send them all as you've kind of worked through processes that you've been testing. So kind of based on your experience and what level of comfort you have with them.
Will you be giving us some feedback if we do the PDSA and it's not, I don't know how to say it, as good as it's supposed to be, as competent as it's supposed to be? I don't think it should be that hard.
Yes, certainly. So similar to the process flow, you'll be able to upload your PDSAs to that key to submit, and there'll be an option to select, would you like feedback? Feel free to select at any time you want more information, or if you email them to us, you can ask for feedback on them as well. And happy to go into as much detail as you want, provide extra strategies, different areas that you can improve upon in the future one. But the worksheets that were provided kind of walk you through the process, have questions to prompt what steps you should take in each component of the PDSA cycle, and we'll delve into that a little further on the February 27th call, but I'm happy to give any feedback that helps you move forward in your improvement efforts.
So is that worksheet part of what's been provided in the handouts already, the PDSA worksheet? I think there's, let me look through here.
I believe Kristen Fluid
is on worksheet with goals and in front of it.
It's on the main site that has all the slides, the handouts, and then there's a quality improvement component, and there are one of two PDSA worksheets that you can use. Either of those are fine to submit them. Yeah, so that at that link, if you click on that, there'll be a spot to get all the content for this collaborative, and the bottom portion of that web page, I believe, has two PDSA worksheets that you can choose to complete.
Okay.
Can you send us this slide deck with an email also? So we have all the websites.
Yes.
Does every PDSA worksheet that's submitted, meaning we're due for 3, have to have a worksheet? I would assume the first one does.
Yeah, so you'll be doing lots of test to change and plan to do study X cycles throughout this, but you only need to submit 3 on a PDSA worksheet.
Has left.
Hey, did anyone have any other questions or things they wanted to chat through with us today?
Has left.
Well, thank you.
Well, thank you all for all the great work. Please, if there's one thing I want to leave you with, it's that I am here to help you along in the process. I am pretty obsessive-compulsive about email. So if you have anything that comes up, question, you need something, where is this, I'm having trouble with this, please email me, and we will help you along and be very quick and responsive. So, and I will send out an email today from a follow-up from the call with all the information that we've referenced and the slides, and make sure you have all the links and everything you need. So appreciate you taking the time to join us today, and let us know if there's anything we can do to be helpful.
Thank you.
Thank you.
Thank you, Kristen.
Has left.
Are you still on the line?
Has left. Has left.
Kristen?
Has left.
Yes, I'm
has
still
left.
here.
Okay. If you